African Society of Psychiatrists warns that mental health care in the country is collapsing. It says months after the Health Ombudsman's damning report on the Life Esidimeni crisis, many hospitals are still under-resourced. We're joined by the organization's president, Professor Bernard Janse van Rensburg. Thank you so much for coming in to talk to us this evening, Prof. Let's start off by asking how much improvement there has been since the Ombuds report came out.
Thank you. I think it's important to note that there was significant input since the Ombuds report. There were certain timelines set by the Ombuds at the time, and by the sheer volume and extent of the task, I think it took a bit longer. So there's been much progress with securing the immediate crisis at the time, replacing patients back into facilities. There's also many other progress aspects on progress that's been made. For example, the Human Rights Commission has been starting to look into setting up hearings. Some other important investigations task teams has been set up, for example, on the licensing of the NGO. So there's been a huge amount of work done in the past 3 months, and I think that must be acknowledged.
All right, it's certainly important to do that,
yes.
But now we're still facing the crisis, you say, that entails the health system bordering on the verge of collapse.
Yes.
What exactly do you mean by that? What are the problems?
Thank you for that question. What we've tried to do with our call, our second call, so to speak, this time around today was to look a little bit beyond Gauteng, also to the other provinces. And our statement is in the context of a recent forum of our provincial structures that met earlier this month in Cape Town. And really just as grassroots professionals who are responsible for day-to-day care for patients, different areas, rural, urban, across the country, Eastern Cape, Limpopo, Free State, and so on.
So what are you seeing on the ground? Is
that going back into a little bit more detail on what is happening in different hospitals, we really are still very concerned in terms of what is available, what is daily happening in terms of the resourcing and the staffing of services in districts and also hospitals.
So what exactly are the problems? I mean, if you looked at a day in the life of a particular patient in any of these provinces, what would that daily experience be?
I think the types of reports that we've heard from our provincial representatives include the understaffing, big psychiatric hospitals, up to 300-400 beds with no psychiatrist currently employed. Lots of posts not filled. Yes, for us, importantly, psychiatrists not being employed, but we are working in a multidisciplinary team. And therefore one would include the whole group of professionals: nursing, social workers, psychologists, occupational therapy, which is so crucial for social rehabilitation in community settings outside of hospitals. So the more one would have wanted to see a proper type of deinstitutionalization process, until there's community-based teams which could pick up these services, resourced, supported, logistics being planned, sorted out, funded. I think we will keep on struggling with putting integrated and a comprehensive service in place. Yes.
I just want to ask you, I mean, I understand that there are mental health directorates and mental health review boards. Why are they not flagging these problems and doing something about them?
The first point about the directorates is a very important point that's been clearly highlighted by the National Mental Health Policy Framework and Action Plan, which has a very specific objective in having mental health directorates in each province, which is the beginning of all the planning and operationalization of policy in the districts and provinces. So it was still concerning to hear from the reports that in several provinces that there isn't even really a directorate. That will clearly then lead that no programming is actually actively planned and no budgeting could follow that. So that's, I think, where the concern seems to lie. In terms of the mental health review boards, if we look at the Mental Health Care Act, the legislative framework in which we work, that is the watchdog for human rights included in the legislation. And if those structures would not be functional and active, it would then clearly mean a dilemma and a problem in securing decisions, processes. They listen to appeals, supposedly. They are strong, independent, supposedly, to be bodies which can take action, call people to testify in front of them, release people from hospital, or whatever the case may be. They, in turn, also work with High Court judges if necessary. So that is the protective mechanism in the legislation, and we have just also taken note of reports across the country of either dysfunctional or even many provinces where in several areas these review boards have not even been set up. So that is for us a big concern for that reason.
All right, thank you so much for bringing these issues to our attention. That was the president of the South African Society of Psychiatrists, Professor Bernard Janse van Rensburg.